The first products I'm going to talk about are nicotine replacement therapies, or NRT in short. Now, nicotine replacement therapies have been around for the past 20 years or so. They work simply by replacing some of the nicotine your smokers would have otherwise received through their tobacco. The thing to remember about nicotine replacement therapy is it is nothing like smoking. It only replaces a small amount of the nicotine and less rapidly. Therefore, it's not the same as smoking. And this is an important message to get across to your clients. Many people worry about the safety of nicotine. The thing to remember is that smokers have been used to large doses of nicotine over many years. Nicotine replacement therapy is safe. It only provides nicotine without the many other toxins found in tobacco smoke. So even people with cardiovascular disease, that is people that have had a heart attack or a stroke, can use nicotine replacement therapy. The first nicotine replacement product I'm going to talk about is the nicotine patch. It's actually one of the most commonly used products and also the most easy to use. It provides some of the nicotine that smokers would have otherwise got from their tobacco smoke through the skin slowly over the day. Now, when talking to your clients about the patch, it's important to give them some clear and simple instructions. You may even have to show them how to take the patch out of the packet and peel it off the sticky backing. So the patch has an adhesive backing, and you need to put this patch on a clean, dry, hairless piece of skin. Usually the upper body is quite convenient, either the shoulder or the chest, but at the end of the day, it doesn't really matter where you place it as long as it's fixed firmly to the skin. The nicotine patch is really associated with very few side effects. It is common to get a little bit of redness on the skin when you remove the patch. Advise your patients to rotate the site daily. Move it around their body. Sometimes people also notice a little bit of itchiness. Again, this is common. If people develop a rash, then you need to advise them to stop using the patch. The patch may not be good for people with skin conditions such as psoriasis or eczema. Regarding the use of the patch, you should advise people to use the full-strength patch for at least 8 weeks. There are lower strength patches to use to help people cut down or wean off afterwards. These aren't strictly necessary, but some people like the thought of cutting down over time. In total, the duration of patch use should be 12 weeks. One really good bit of advice to give your clients, because I know a lot of my patients do this, is that they slip, they take the patch off, they have a cigarette, then they put the patch back on. Don't get them to do that. Instead, advise them to keep the patch on no matter what, because wearing the patch, if they have a slip, it may prevent relapse. The next nicotine replacement product I'm going to talk about is the nicotine chewing gum. Now, the nicotine chewing gum is also a popular product, but it's one that's not always used particularly well. The nicotine gum works by providing some of the nicotine that the smoker would have otherwise got from their cigarette smoke. The nicotine from the gum is absorbed across the lining of the mouth. Now, because of this, it's important to use the gum correctly, and there's a certain technique in doing this. You may already know that the way to use the gum is a chew, park, chew technique. Now, when you're instructing people how to use the gum, you need to say to them something like this. I'd like you to take a piece of gum and I want you to put it in your mouth and give it a few chews until you get a hot, peppery taste. Now, when you experience that hot, peppery taste, I want you to stop chewing and rest it in the side of your mouth. Just park it between your cheek and your gums and let it rest. Now, the reason you're letting it rest there is because it gives time for the nicotine to be absorbed across the lining of your mouth into your blood. And that's what's going to help relieve the craving and other withdrawal symptoms. When the taste starts to fade, give it another few chews until the hot, peppery taste comes back. When it does, store it again in the side of your mouth. So you keep repeating this chew, park, chew technique for about 30 minutes. After 30 minutes, most of the nicotine's been absorbed, so you can spit the gum out, have a break, have something to eat and drink. Now, I'd always advise people to use a piece of gum every hour. Using it regularly is better than using it just when you need it, especially during the first weeks. People will get used to knowing how many pieces of gum they need to use a day. But on average, I'd say somewhere between 12 and 15 pieces a day is some good advice. Now, many people when they use the gum will complain of the taste, and so I'd recommend that you really emphasize the fact that the gum doesn't taste very pleasant to start off with, but reassure them that they will get used to the taste over time. Now, some people might come back and say, this gum has given me terrible mouth ulcers. It's a common effect of stopping smoking, but it's not caused by the nicotine gum. It's caused by stopping smoking, unfortunately. Another symptom that people may complain about are hiccups. Now, hiccups are caused by people swallowing a little too much of the nicotine. If people complain of this, check their technique. That's probably the cause of the hiccups. Now, how long should you use the gum? Well, again, advise people use the gum for 8 to 12 weeks. That's going to give them the best chance of long-term success. So some key points with the gum. Advise on correct usage. Remember that chew, park, chew technique. Advise people that it doesn't taste very nice to start off with, but they will get used to the taste over time. Use it regularly, use enough of it, you'll get the best success in that way. This is the nicotine lozenge. The nicotine lozenge works by providing some of the nicotine the smoker would have otherwise got from their cigarette smoke. It's quite easy to use. Essentially, you take the lozenge, you pop it in your mouth, roll it around. The nicotine from the lozenge is absorbed across the lining of your mouth. Some people like to suck it for a little bit and then just store it in the side of the mouth. This gives time for the nicotine to be absorbed. The nicotine lozenge should be used regularly. I always advise my clients to use one lozenge every hour. They should suck it for about 30 minutes. After that time, they can spit out whatever's left, take a break, have something to eat and drink. But on the hour, every hour, a new lozenge in. The lozenges come in two different strengths, high and low. The high-strength lozenge is for your more dependent smoker. Now remember, you can quickly assess dependence by asking a simple question. How soon after you wake up do you have your first cigarette? If someone smokes within the first 30 or 60 minutes of waking, then they are more highly dependent, and the high-dose lozenge is the right lozenge for them. For those that smoke after that time period, they can start with the low-strength lozenge. However, should they find that they need to use the higher strength lozenge because their cravings aren't being well controlled, that is absolutely fine. Some of the common side effects that people complain of with the lozenge are bad taste, and like all oral NRT products, these things don't taste very pleasant to start off with. Reassure them that it's normal and they will get used to that taste over time. Another problem they might encounter are hiccups. This is caused by swallowing too much nicotine. Swallowed nicotine isn't dangerous, but it can cause hiccups. If they experience these, check their technique. They're swallowing a little bit too much nicotine. So advise them to suck less and just store it in the side of their mouth a little bit more. Again, it's really important that people use these regularly, on the hour, every hour. So people should be getting through about 12 to 15 lozenges per day. It's also important to use them for long enough. I'd advise 8 to 12 weeks. So some key messages for the lozenge. Again, get people to use them regularly. Reassure them that the taste may not be pleasant to start off with, but they will get used to it over time. And use it for long enough. People stop using these products far too early. It's better to get through the worst period of withdrawal using these products to help make quitting easier. This is the nicotine inhalator. It, like other NRT products, works by providing some of the nicotine that smokers would have otherwise got from their cigarette smoke. The good thing about this particular product is it also provides a little bit of behavioural replacement, perhaps the hand-to-mouth action or the puffing behaviour that some people miss when they quit smoking. Now, the inhalator, despite its name, does not provide you nicotine to your lungs. The nicotine is absorbed from the lining of your mouth, just like the gum and just like the lozenge. Therefore, you need to use this regularly. The first thing to advise your clients when using the inhalator is to help them in opening the tube. There are two grooves on the tube which need to be lined up so that you can pull it apart. Once it's pulled apart, you take one of the capsules, which contains a sponge with nicotine in it, and you pop the capsules into the tube. You need to push it until you hear a click. Then you put the other end on, and again push it until you hear a click. Now the inhalator is ready for working. The thing to remember here is, though, that one puff on a cigarette is 10 puffs on this. So you have to use this quite frequently to get the same levels of nicotine that you would from tobacco smoke. So, again, advise people to use this regularly. I always say use it every hour and puff it for about 20 minutes each hour. After 3 hours or so, you'll need to change the cartridge. You should be aiming to get through around about 6 cartridges a day. That should be enough to help relieve some of the withdrawal symptoms and cravings that your patients may experience. People sometimes complain of the bit of burning or stinging in their throat. This again is normal, and you can reassure patients that that is fine. In the colder weather, it's important to keep the inhalator warm. This is because nicotine is going to be better absorbed. Remember, nicotine's absorbed through the lining of the mouth with this, not through the lungs. So some key messages here. Use this regularly, once an hour, every hour, and puff on it for about 20 minutes. And like all NRT products, recommend that people use this for some 8 to 12 weeks. That will give them the best chance of success. This is the nicotine mouth spray. It works by providing some of the nicotine the smoker would have otherwise got from their cigarette smoke. The good thing about the nicotine mouth spray is it relieves craving quickly, and so it may be good for your more dependent smoker. Now, it does require a little bit of instruction to use it correctly. First off, you need to show people how to open it. There's a lever at the back which they have to depress and then slide up. This gives you a nozzle. Next, you need to get people to prime the spray. This is done just by simply spraying it a couple of times until you get this fine mist. Next, instruct people to place the nozzle close to the mouth, directing it towards the side of their cheek. What you want to get is a nice fine spray sprayed against the lining of the mouth. Try just one spray to start with. If that doesn't relieve the craving, another spray can be used. I recommend people use this hourly. Regular use is always better. But if people want to use it just when they need to, that is also okay. I recommend people use this for 8 to 12 weeks. It can be used for longer if needed. The most common side effect with the nicotine mouth spray is hiccups, and this is because people swallowed the nicotine. If people report hiccups, check their technique. Make sure they're just spraying that mist against the side of their cheek and not swallowing the nicotine afterwards. If they use this properly, they'll really find that it can reduce cravings very quickly and increase the chances of long-term quitting. One question that I often get asked by my patients is, can I use a combination of these nicotine products? The answer is simply yes, absolutely. And remember, there's evidence to show that using a combination of NRT can increase the chances of long-term quitting. The most sensible combination is to use a patch and one of the faster nicotine replacement products. Using these combinations is going to increase your chances of quitting smoking for good. Nicotine replacement products are safe to use, especially in those people who smoke. However, they can make children and other non-smokers a little bit sick, so please keep them out of the reach of children.